Nothing. The floor, the ceiling. Just a makeshift bed and my brother Owen. We got the S-bar sheet. Nothing on it. Nothing on the back. And I don't have my gown, so I dressed up a little bit for you guys. Here's some identification for you before we start.
Yes, sir.
Alright. 3, 2, let me make sure that. 3, 2, 1. Actually, put the hand sanitizer over there. On the ground. Thanks. 3, 2, 1. Good afternoon, Mr. Gambrell. My name is Nurse Gambrell, and I'm going to be doing an abdominal assessment on you today. Can I go ahead and get some identification on you?
Yes, sir. There you go.
Appreciate it. Date of birth?
March 24th, 1998.
Awesome. Thank you so much. So before I start my examination, I'm going to have to ask you a couple questions, just get some subjective data for you. So have you had any abdominal pain?
No.
Any indigestion?
No, none lately.
Any constipation?
No.
Have you ever had hepatitis A, B, or C?
No.
Or been exposed to anybody with hepatitis A, B, or C?
No.
Have you ever, or have you been vomiting or have nausea lately?
No.
Have you had any family history of abdominal pain or surgery or anything like that?
No.
Have you ever had abdominal surgery?
No.
When do you have regular bowel movements?
Yes.
Can you give me a color or consistency usually?
Usually they're, usually they're brown and they have just a relatively smooth surface.
Okay. And then urination as well. Do you urinate pretty regularly?
Yeah.
The color is?
I'm pale when I'm hydrated.
Okay.
Yellow when I'm not.
Awesome. Okay, so now I'm going to ask you some more questions. Do you drink alcohol?
No.
Do you smoke or do any tobacco products?
No.
Are you prescribed to any over-the-counter medications or medications in general?
No.
Do you have any stressors in your life?
Stresses?
Like things that stress you out?
No, not any great deal. I mean, work a little bit.
Yeah. And what about your diet? Can you just give me a daily diet, like what you eat in the morning, evening, afternoon, and evening?
Sure. I get a bowl of cereal for breakfast in the morning most days.
Mhm.
For lunch, I try to grab something with a meat and 2 veggies kind of deal, or I usually pack it. And at dinner, I usually cook something along those lines.
Okay, awesome. So that's it for that portion. Next, I'm going to go ahead and get some vital signs on you, okay?
Okay.
The first thing I'm going to do is take your respiratory rate. I guess I can just do it on my phone because I lost my watch. Alright. So go ahead and sit up for me. I'm going to get your respiratory rate. I just want you to breathe normally, alright?
Is this good?
Yeah, that's perfect. Now just breathe normally, alright? Down 3, 2, 1. Alright, your respiratory rate is 14. So next I'm going to begin with your pulse. So I'll put another chair just so it makes it a little bit easier. Okay. 3 in 30 seconds, so your pulse is going to be 66. Okay. Next, I'm going to take your blood pressure. If you could just scoot up a little bit for me.
Okay.
So I can sit beside you. And you said your right is your dominant, correct?
Yes.
Just like these little shadows or something. Okay, okay. And slide your arm in here. Well, actually, I just put it on you. Just make sure you get your skin. Alright. So just relax your arm. Right here for me. Your hand open. Alright. Good. If I can get my stuff done. Alright. And what's your blood pressure normally?
Well, it's not particularly high.
It's like 140-ish or 130, what do you think?
Oh, 30, maybe 40 really. Yes.
It's about 127, right?
Oh. Maybe it's not as good as I thought.
Like 128 over 70, okay?
Okay.
So, let that air out for you, buddy. Get this off of you. Walmart brand blood pressure cuff, not the best. Alright, so your vitals were blood pressure was 128 over 70. Respiratory rate was 14. And your pulse was 66. I'm going to take your temperature real quick as well. We didn't have a tongue thermometer as well as alcohol swabs, so I'm just going to use head thermometer. Go ahead and turn to your left. I'm going to put it on your temporal region. Make sure it's on skin. Alright, 99, which is normal, or within range, I should say, for especially for someone his age. Alright, so now we're going to begin the examination. If you have any questions throughout the examination, just let me know. Throughout the examination, I am going to be auscultating, which means I'm going to be using my stethoscope.
Mm-hmm.
I'm going to be palpating, which means I'm going to be using my fingers to push in, and I'm going to be percussing, which means it's going to be just light hitting on your stomach, just so I can hear a type of noise that I'm looking for, okay?
Okay.
So go ahead and lift your shirt up, all the way up. Perfect.
Clear?
Nope, just right here's good.
Oh.
Okay, so the first thing I'm going to be doing is auscultating. Alright. Put this thing somewhere. So I just want you to go ahead and just breathe normally, just try to relax, alright?
Mm-hmm.
And if you could, can you lay down a little bit more?
Yeah.
There we go.
So is this good?
Yeah, that's perfect. Okay. So I'm going to start in the right lower quadrant. And you just want to listen for normal bowel sounds. Usually you would do this for a minute, but because I don't want my video to go longer, I'm just going to say I would do it for a minute. And you go up and you go in a clockwise motion. Just listening for bowel sounds here and here. Oh, and before you would auscultate, I forgot to mention this. You would examine the abdominal area first. I'm kind of got ahead of myself. You would start looking for vascularity, any type of tenderness. I would ask them if anything's tender. I would look at the contour of the abdomen, which is flat. There's no weird coloration to it anywhere. I'm not seeing any aortic pulsations, and he doesn't seem to be in pain. So you don't have any pain anywhere in your abdomen, correct?
No.
No tenderness or anything like that. Awesome.
No.
So yeah. All right. Now I would start with the auscultation, which I'll just pick up where I left off, which was where I was auscultating the 4 quadrants. And now I'm going to use the bell to listen for some aortic pulsations. So I'm going to start at the lower part of the aorta. You can definitely hear some beating there. Move down and listen for some brewing in the renal areas. Go ahead and use my bell as well, or diaphragm as well. No brewing. Just a lot of stomach noises.
Or stay recently.
Yeah. So then I'm going to follow his pulse down. So his aortic pulse, his iliac, and then his femoral. You would all do those for 30 seconds to a minute. His femoral's here. I just don't want to, take his pants off, whatever. Iliac is just between the crest of the iliac and to the umbilical region. All right. So next, after that, I've already auscultated your 4 quadrants as well as listen for your pulses and your aortic pulse and see if there were any brewing in any areas, and there was not, so that's a good sign. So next I'm going to go ahead and begin with some palpations. Okay. Which means I'm just going to, or I'll do percussions first, do palpations later, because I don't want you to tense up. So percussions is where I'm just going to take my finger, and I'm going to go like this, okay?
Okay.
Alright, perfect. So I'm going to start in the right lower quadrant. Move my way up. And it should be very tympanic. It should sound like a drum, because there's a lot of air in this area, and not a lot of organs. When you get over an organ, there will be dullness. So next I am going to percuss for your liver and your spleen.
Okay.
So here's your bottom rib. When I'm doing this, I'm going to measure your liver as well to make sure there is no enlargement of your liver. Okay?
Okay.
So I'm just going to draw a line on you. You should be able to wash it off, it's no problem, okay?
Okay.
So first I gotta find the bottom of your liver. I'm gonna start to the left of his mid-clavicular line, and closest to his umbilical, but lower than his bottom rib. And it should be tympanic. until I reach his liver, which will be dull. Go ahead and make a mark there. Then I'm going to start a little bit higher, making sure I'm going in between his intercostal spaces, because if I just hit a bone, it's going to be dull. So it doesn't really matter. Alright, I gotta find them. There's one. Perfect. And this should be no larger than 8 centimeters. He's at 6, so that's perfect. Okay, next I am going to, let me write that down. Next I'm going to percuss for your spleen. So the easiest way to do this is to find his last rib and then go up to his 10th rib. I'm going to ask you to take a deep breath in, and then I'm going to percuss.
Okay.
If I hear dullness, then that means your spleen is enlarged. If I don't hear anything, or if I hear tympanic, then that means your spleen has risen with your inhalation. Okay?
Okay.
So go ahead and take a deep breath in for me. And you can really hear that tympanic drum beat on that. So his spleen is not enlarged at all. Alright. So next, I think that's all the percussing that I have to do. I'm going to go ahead and do some light palpations. The purpose of the light palpations is to just go ahead and get him used to my touch, as well as try to feel for some masses and look for lesions and contusions and scarring and things of that sort. So I'm going to go ahead and do that. So just let me know if you have any questions throughout it. I'm going to just start palpating.
Okay.
You want to use the pads of your fingers. You want to start in the right lower quadrant, just feeling for any masses or anything like that. Good. Good. So next you're going to want to do a little bit more deeper palpations. This is important when you're trying to see if he has appendicitis or a swollen liver, gallbladder problems, or an enlarged spleen, or organomegaly, which is like if his organs were too large, or certain organs were too large. So I'm going to push in a little bit deeper. Just let me know if you have any pain throughout this as well. That can really help me figure out what is wrong. Okay.
Okay.
No pain?
No.
Okay. Make sure you're going in a clockwise area, as well as checking the umbilical region as well as the 4 quadrants. So next, I'm going to do a test on his liver. It's a hooking test to see if his liver is enlarged. Okay, Owen. I want you to take a deep breath in so I can feel the border of your liver, okay? So, perfect. I can feel it touching the tips of my fingers. You can exhale for me. Okay, so then after that, I'm going to do a couple of tests on you to make sure you don't have appendicitis or any gallbladder issues of that sort. So I'm going to first do a rebound test, which is where I'm going to push down, and then you're going to tell me if it hurt more from pushing down or from letting go, or if there's no pain at all.
Okay.
Which is fine. Okay? 3, 2, 1.
Wasn't really any pain.
No pain? Okay, awesome. You didn't feel any pain on the other side as well either?
No.
Okay. So next I am going to do a test on Mcburney's point. So can you just pull him down just a little bit more?
Yes.
I just need to get to your iliac crest.
Okay.
Alright, it's right there. So what you're going to do is you're going to measure from his umbilical region to his iliac crest right here, and this is called Mcburney's point. 2/3 of the way. This is where his gallbladder sits basically. And this is also helps with appendicitis. So what I do here is I would just push down if there's any pain, just some deep palpations here if there's any pain, and that would kind of help us better understand if he had appendicitis. Just another test to help us with that. Yeah, so next I'm going to do some more palpations. So I'm going to check to see if your spleen is enlarged as well. I want you to go ahead and take a deep breath in. You really want to try to get your fingers under these ribs. And I don't feel his spleen, and there's no hardness or anything like that. Do the same thing on the other side. Take a deep breath in. And you should be able to feel the bottom of the liver touch right here, which is normal. Okay, Owen. I'm done with your examination. There's no masses, there's no problems here. All your organs are not swollen, and there's no abnormalities present. You don't seem to have any signs of appendicitis. During the test that I was doing, so yeah, that should be it. Alright. So situation, so the situation is I'm with, oh god, I guess I'm too close. The situation is I'm with patient Gambrell. I'm doing an abdominal examination on him. Background is he's got normal vitals, he's pretty healthy. He just came in here today to have an abdominal examination. After assessing the client, I'm saying he's completely healthy and has no abnormalities. He has no appendicitis, no appendicitis, no masses in his stomach, no gallbladder problems, no enlarged spleen, nothing of that sort. And I'd recommend maybe doing some more labs to check things that I couldn't see. And other than that, I would have no recommendations.